Good evening, and welcome to Health Plus Weekly. I am Dr. John Podkowa. I'm joined by our co-host, nurse practitioner Hannah Raymond, and we are excited to welcome Terri Martin and Michelle Murray, nurses and lactation specialists, to our show tonight. Tonight's show, we're going to be talking about breastfeeding. And so we'd like to encourage everyone who's watching tonight, if you have questions regarding breastfeeding, to please kind of write in. We're happy to answer them. Also, if you have any general medical questions, Hannah and I are also happy to field them. If you have follow-up questions from our program on smoking, quitting smoking last week, we're happy to follow up on that as well. We hope everyone's having a great summer. We always look forward to finding out where people are tuning in from, so if you please kind of write in where you're watching from, we'd really appreciate it. We'd like to know who's watching. And before we get started with the show, we just want to follow up regarding what we mentioned last week. There's a valsartan medication refill that has been kind of going through the news. So for our patients and anyone who's watching who's on valsartan, it's a blood pressure medication or a medication prescribed for patients who have heart failure or kidney disease, that the newest and most current information is on actually the Southcoast website. You can go to it at southcoast.org and wait for the banner to come across the top, and you can get the most kind of up-to-date and accurate information regarding the recall, and also you can discuss with your pharmacy as well. So with that, Michelle and Terri, thank you very much for coming on the show.
Thank you for having us. Yes.
Yeah, we usually like to start kind of with our guests a little bit of background. So in terms of how you wound up kind of getting into this field that you're working in now, and also how long and what brought you to Southcoast.
My name is Terri Martin, and I became a nurse. I always wanted to become a maternity nurse, and I've been doing maternity for about maybe 13 years. Mm-hmm. And I've always had an interest in lactation. I had my children before I started doing maternity, and that actually was the breaking point, was having children. So my first one, actually, I struggled, and I really gave up really quickly with, and I felt I wasn't really super supported, and I didn't really have a lot of education as far as how important breast milk was. And then when I was pregnant with my twins, I already was going to breastfeeding support groups before I actually delivered, and I was very gung-ho as far as making the breast milk work. And that was a big turning point because I still felt I wasn't really supported as much. And that's what really brought me to the road that I am in today. Okay. So now I've been doing lactation for probably about maybe 6 years, I would say. 6 years probably I've been doing it now. And I've been at Southcoast that whole entire nursing career, and as well as the lactation career.
Oh, wow.
Are you from the area, from this area?
Actually, I was born and raised in Fall River, actually, and now I live in Westport. So yeah, I've been with Southcoast all my life.
That's wonderful. Good. And what about you?
So it's a very similar story, actually. I graduated from nursing school. It's in year 2000. We actually graduated from nursing school together, believe it or not.
Awesome.
Yep. And I didn't start out in maternity initially. I was a med-surg nurse, and I knew I wanted maternity, however. And then I did med-surg nursing for about 5 years, and then went into maternity. Worked labor and delivery for a bit, and just like Terri, had my children before becoming a maternity nurse. And went through some difficulties with breastfeeding as well. Interesting though, I had done a paper in nursing school about breastfeeding, and it was always there on the back burner. I knew it was something I was very interested in, and then just became more passionate about it as I wanted to help the moms, the patients that I had.
Yeah.
So I became a lactation consultant. Probably, I think it's been 10 years, I think, for me, yeah.
Oh, yeah.
And I've been doing that ever since, and it's been at Southcoast the entire time.
That's great.
So what's the additional training like, so beyond your nursing degree to become a lactation consultant?
There's actually different pathways and sort of types of consultants. There are several courses that lay people can take and become a lactation counselor, which is at a lower level of a lactation support person. Terri and I have both become what is called an IBCLC, or an internationally board certified lactation consultant. Okay. So in order to obtain that accreditation, you have to have 500 hours of hands-on with mothers and babies and breastfeeding, 90 educational certified credits towards breastfeeding education, and sit for the exam and pass the exam, obviously. So that's where we're at. We have other consultants that work with us as well at Southcoast, a couple of other IBCLCs and some other CLCs, which is a different accreditation, similar but not as involved.
So you're well versed. You've got a great. And where do you practice now? Are you in the hospital? Do you have support groups outpatient? Like, how can people find you?
I'll let you take that one.
So I work at Charlton Memorial Hospital, and Michelle works at St. Luke's Hospital, and there's also lactation support at Toby Hospital as well. We also have something that we call Baby Cafe, which is a breastfeeding support group that we actually offer in New Bedford on Thursday evenings, and we also offer on Tuesday mornings in Dartmouth and also on Wednesday mornings in Fall River. In addition to that, we also have a breastfeeding support group that's offered in Wareham as well, and that information is actually on southcoast.org as well. You can find that on there. And those are support groups, and that's actually, because what happens after you go from the hospital, those are the hardest days usually, is when you go through and you don't have the support at home because you don't have the nurses at your bedside. Those where the connection is that really can make breast milk and breastfeeding work.
So those are the crucial times
Absolutely.
to have support.
Yeah,
In the
yes.
hospital.
It's
And
a community.
do you see women in the hospital right after they give birth as well?
Yeah, we do. Some of them will reach out to us because when they leave the hospital, they're given our contact information via the phone lines.
Okay.
So at St. Luke's, it's 508-997-MILK. They can call it here. In Charlton, it's
508
973-7062.
Yeah,
And Toby has a line as well. I apologize, I don't know off the top of my head. But they can call us and come and see us for outpatient visits one-on-one,
Great.
rather than going to the group if they wanted to do that. So that's another way for supports. And
and also like the breastfeeding class that we offer, it's free actually. We offer it to the community, and it's monthly at each site. And that's a free, monthly, is it every other month at Toby too?
Oh, Toby, I'm not sure. I think theirs is every other, correct?
Yeah, and that's through childbirth education as well, and that's offered. And it's really important actually to get the prenatal education on it, to actually understand breastfeeding and actually get the tools to actually make it work.
Yeah. I think it's such an important resource that we have, which is so nice for women. I remember when I was in medical school, going through my kind of OB, rotations and recognizing that, one, learning how fundamentally important it is for children, for breastfeeding and all the health benefits, which we'll talk on. Two, how it is a learned skill and how it's hard, in that I think there's perhaps this expectation that it's going to be really easy, it's natural, but it really isn't. And these, some of these women, and I went through this when my wife was pregnant with our sons too, like they were exhausted from having children and just the process of delivering. And then there's a little bit of pressure in terms of doing this, and there's a lot of emotions, right, and a lot of probably unwarranted advice from different people and different things, and trying to help coach them and get this to work. And some women it works really. And a lot of women put a lot of pressure on themselves to do this, and and kind of helping get them through. My poor wife, I remember, like she was so excited in doing it and just had trouble. Like, just like you said, like it was fine in the hospital, and then home, and things kind of went off. Kind of the wheels coming off the bus, and just. Oh, the poor thing got like so engorged, and like one day I came home and I was like, oh boy, oh boy, we need to go back. We need to figure something out here because that's not comfortable, and so it's great that you're there for the women.
And I think too, like in other countries, there's a whole team. As soon as like a woman comes home and they deliver at home, they actually have a whole team of women that come to their house. They cook, they clean, they take care of the other kids, and the mom really doesn't have to do anything. And they teach them how to breastfeed. We have lost that through a lot of our years because it was more so. What's the word I'm looking for?
Scientific and medical in the hospital. The babies all had to go to the nursery, and it was not,
Yeah, it was. We did a lot of separation at that time because we didn't know a lot of the research on it. So I think now we're kind of connecting that with that more. But now that you have a lot, in the United States of America, a lot of women go back to work early. They have to financially do that. Their mothers are working. They don't have that support team that comes over to their house and really help them out. And I think it's that disconnect that we're having. Yeah.
It's funny though, the scenario that you just described is exactly what I saw today when I was at work today, and it is difficult, for some women, breastfeeding does come more naturally and more simple. It does happen, but for the majority of women, it's a learned skill.
Yes.
You know, so my conversation very often is, you know, if breastfeeding was that easy, we wouldn't have a job.
Yeah.
Yeah, exactly. There wouldn't be a specialty.
Correct, right. There's a reason for it, because it is something that takes a lot of practice and a learned skill between mom and baby. And the great thing is, and we'll probably get to this, is some of the things that Southcoast has done on our baby-friendly journeys to really try and make that initial breastfeeding experience better and easier for the moms and the families. So yeah, I'm sure that's something we'll probably get to.
Yeah, definitely.
And I have to tell you, I actually had a friend who actually is from Switzerland, and when she asked me what I did, she's like, "You get paid for that?" Because their breastfeeding rates are phenomenal.
Yeah.
I mean,
Are they really?
Oh yeah. They're
Who's the
at
best?
90%.
You know, so what are the rates?
Have a baby in Sweden.
Oh yeah,
Sweet.
yeah.
Okay.
Yeah.
Where else? Where else is?
Well, that's the highest.
That's the
is like,
highest.
yeah, in that area.
That's the highest.
Okay,
I
and in
think
the
about
U.S.
80% of women, I think, are breastfeeding in the United States.
Initiation.
Yeah, initially.
Yeah, the duration is where it really falls.
Yes.
The CDC posts the breastfeeding report card. The latest one is from 2016 that recently is, and our initiation rates are up, which are wonderful.
Because of the education.
But the exclusivity of duration is where it really falls. I mean, just for example, the Southcoast rates, for example, I can speak for Charlton and St. Luke's. Toby isn't really collecting this as much because they've been on the pathway much longer. Our initiation rates at our Southcoast hospitals, the bigger campuses, about 70 to 75% of the mothers come through saying they want to breastfeed. Our exclusivity rate, so babies leaving the doors having nothing but breast milk when they leave, is about 35, 40.
Really?
Yes.
Okay.
Yes.
So what happens between then and then?
Before we do that, let's just talk about why it's really, really great.
Important.
If you know, and I think it would be really important that, you know, for some reason some women can't, or, you know, it doesn't work out, and that's okay too, right? I mean, there's, you know what I mean, but let's talk about the benefits of breastfeeding for mom and babies, if we start there, please.
Yeah, absolutely. So there's a lot of benefits, and the importance of breast milk is really important to talk about, and that obviously is talking about the benefits. So with mom and baby, actually, they both benefit from it. With moms, if they actually do provide breast milk for their baby, it decreases their risk tremendously, actually, for breast cancer and ovarian cancer, as well as type 2 diabetes. Actually, as well as for the babies, it decreases their risk of type 1 and type 2 diabetes, as well as decreased risk of ear infections, respiratory illnesses, Crohn's disease. I mean, I can go on.
There actually has been new research with certain leukemias as well, and SIDS. We know that that's data that's out there as well. So, and the interesting thing with the benefits
the longer
it's, you know, a dose relationship. So the longer the mother breastfeeds for, the greater the percentage of decreasing your risk of those things are. Okay. So if you're a mother who breastfeeds for just a couple of days or a week, the baby will reap some benefits, but not nearly as much as the baby that is breastfed for a year, which is recommended or more.
Yeah, and the biggest
Same
thing
for
is
the
the
mother.
immunity too. The immunity, and one of the biggest things, World Breastfeeding Week, every year they pick actually different themes, and this year is actually the foundation of life, because you really build a foundation for the rest of the baby's life. Building up the immunity, if actually a mom breastfeeds for a whole year, that baby's immunity equals the same as their mother who's breastfeeding.
Wow.
So that's tremendous, because it's taken so long for that mom to build up the immunity. And for example, if let's say if I was formula fed and I was breastfeeding my baby, but my friend was and she was breastfed, she passes on better immunity than I would to my baby because she's got a better immune system than I do. So her baby's already starting off even better with immunities. Yeah.
The other thing that, you know, this is interesting because I'm not sure if you hear this on your shows with others and everybody's in this probiotic phase and all this importance. The best start to having the prime gut, in a sense, is by exclusive breastfeeding at first. So by not introducing any other supplementations via beef formula or any other, you know, water, whatever. Water was pathetic, but anything, sugar supplements. You're not altering that, you know, perfect microbe gut to start. Exactly. Yeah. And it actually starts with the delivery process. Right. The bacteria of a through the vaginal delivery, correct. Yeah. The exposure to that bacteria automatically starts the process of the good, you know, good bacteria that babies know from the get-go. Yeah.
So great things for babies. What about for moms, the benefits?
Yeah. So some of them Terri mentioned, decreasing the breast cancers, ovarian cancers,
the type 2
diabetes for the mother. And you know, the interesting thing too is the connection with mom and baby when they're nursing so if baby is sick, you know, baby has a little sniffle or has a cold, the baby actually transmits the through the mother by breastfeeding, so the mother can develop the antibodies to fight that. And it goes both ways.
Yes.
You know what I mean? It's amazing.
Yeah. I used to try to catch my baby's cold. Because I would pass the immunity quicker. Yeah, they would be sick. I'd still be sick, and they weren't sick anymore. I'm like, why can't I get over this?
And then there's financial benefits too.
Oh yes,
as well.
without a doubt.
Yeah.
Yes, without. I mean, I think this is an estimate. Last I heard, formula could be anywhere from $3,000 to $5,000 a year. Don't quote me on that, but I believe that was a late. So without a doubt, for sure, the financial benefits. And then you don't have the risks. So also, there are recalls on formula.
Yes.
There are risks involved with formula where powder formula isn't diluted correctly. They're not getting the right constitution. Powder formula is actually really. That's a tough topic in general.
It also helps with women's metabolism and everything while they're nursing. I remember.
Oh yes, exactly. Yeah.
I have a funny story about this.
Well, it's funny. Usually when I discuss this in breastfeeding class, I bring up Giselle Bundchen at that point in time. One of the best breastfeeders we have locally. And look at she got back to her breastfeeding weight wonderfully, a pre-pregnancy weight, I should
look
say.
at her,
Yeah. You know what I mean?
I was
Yes.
back to my pre-pregnancy within a month, but I was breastfeeding twins.
Twins.
I was eating like a horse, like a horse.
Yeah. So we had our children, I was in end of medical school, and I was in residency, like the second year of residency when our JJ, our second son, was born, and it was just working a lot. But I was just gaining weight, and my wife, who was always fitter and just had much better genes than I did. You know what I mean? Was thin. She's like, oh my god, this is great. I don't know, everything's. I feel bad for you. What are you eating? And she was kind of I don't know, Nicole. I feel like we used to eat the same thing, and I'm just not doing so well here anymore.
That's so funny.
All of a sudden, it was funny. I'm like, I think this is because you're breastfeeding. I remember this. I think this is an unfair advantage that you have because and it was so funny. So when she stopped, which we'll talk about, which there's a whole separate thing.
Yes,
her metabolism totally changed, and she was like, oh my god, I don't know if I.
That's so funny.
Because you still keep eating like you were while you were breastfeeding.
Yeah, no,
you get used to that,
definitely.
That's kind of funny that
That
you
is
remember
so
that one and we
hilarious.
didn't even think. Remember?
Oh, I remember. No, because we were a little bit competitive, and we used to be able to eat the same things, and we kind of had the same weight and metabolism. And I'm like, what is going on here? Because I am not looking like you. And so,
That's wonderful.
Yeah.
So we have a lot of people tuning in, which is great. So Helen says hi. Margaret and her new baby Hermione are watching. So hi,
Hello, Margaret.
hi.
Grace is watching, and Shalina and Kristen and Anita. A lot of people from
I love it.
around the area. So
good.
keep the questions coming. And Carrie said, "Yay! Support for women. Breastfed her son for almost 2 years. Very hard at
Wonderful.
first.
Oh, that's awesome.
And had great
Awesome.
support in that first month. Nursing is not easy at first, but with the right help, it can get easy. And
Exactly.
so reach out.
Oh, yeah,
Exactly. That's
awesome.
great. Thank
Yes.
you. Yep.
Yeah. So when, after birth, when do you start breastfeeding?
Immediately.
Oh, yeah.
As soon as possible.
Yes. Exactly. So right after the baby is born, ideally the baby, mom and baby are both stable, healthy. The baby is immediately put on the mother's chest, skin to skin. So. And you basally just leave the baby alone.
Which, by the way, I was robbed of skin to skin.
Yes.
I was robbed.
Yeah, skin to skin wasn't really promoted
promoted
and
back
initiated
then,
back
yeah.
when we had our kids, going a while ago.
But we see such a great transition with
Yeah.
the babies with skin to skin. It's amazing.
Right, and so the initial exposure of the baby skin to skin is really crucial. Babies actually go through, there's been a designated 9 stages of what's called the birth crawl or the miracle hour. So, Owen, help me if I get some of these wrong, I'm on the spot.
We won't count.
It's the original, first it's the birth cry, okay, then it's a rest period, then it's an awakening, and then it's some activity, and then it's the crawl. And the crawl I love.
Yeah.
Because when we did labor and delivery,
And when
we
they
don't do
woke
it as
up.
much now.
I love that.
At some point in time after the baby was born, you could always say to the mother, do you feel the baby kicking their feet yet? Do you feel the baby kicking their feet yet? And the baby would always, at some point in time, would do it.
Would do it, yeah.
And I love it because it's the baby's natural instinct to do that, and it's also pressing on mom's uterus, which is a bonus.
massaging, yeah.
Right. And then they'll have a familiarization phase, which is right when they're close to the breast and just about finding their way, and they're so close to doing it. And then suckling when they finally get there. Sometimes they'll suck their hands or try and make a nipple someplace else, but for the most part they'll do it. And then it's finally, sleep is the 9th stage. I hope I got them all. I'm not sure. I think I did.
That sounds about 9.
Yeah, there you go. But that's been documented well, and there's so many videos documenting that this is what occurs. So this is something that Southcoast has done a great job with. You know, it's part of our accreditation that we're working towards now with Baby Friendly, that all babies are put skin to skin after they're born. I mean, Terri and I have been collecting this data for years now to make sure that at least, you know, we're meeting the, we would like 80% of our moms to be making this, and we're achieving that and more. So, and even with our cesarean babies that are born via C-section, we're doing a great job. It's something referred to as gentle C-section, you will hear, you know. And so the babies will go skin to skin right in the OR. They're using a clear drape so the mother can see the baby being born. Yes, exactly. So this is going on at all 3 sites really well. Yeah, Toby's been doing it for a long time, and we're doing a good job now too. Yeah. Good. So immediately, yes.
So start trying immediately.
Right.
Yeah, and actually, there's one note I want to actually add too, is actually when the baby starts, the baby's geared by smells and touch.
Oh, yes.
So the colostrum actually is similar with the smell with as amniotic fluid, so the baby's very familiar with that scent.
Okay.
And so actually, if you just leave the baby alone, you can see the baby actually start going.
Working towards,
That's wise because
the
they're
smell.
geared by smells.
So what's the difference between the colostrum and breast milk, kind of that people think of later?
Oh, yeah. So colostrum is the first
Good
milk.
question.
So during the pregnancy, the mother's body is already starting to get ready to produce milk. Some women will actually leak colostrum during their pregnancy. Not all do. And for you moms out there, if you're not leaking, it's okay. You'll have milk.
Yes, I never leaked, and I did fine.
Right. Colostrum has, because when the baby is first born, it does not need to have the caloric intake to start growing yet. It just needs the prime, you know, antibodies and immunities right away after it's born, and you know, and the sugars to maintain initial life after it's born. And then as the baby grows, then it needs to have the calories for growing in volume. Exactly. Right. So they don't need much at all in their first day.
And the baby makes its own milk supply, so really foundation of doing that those first few days of life. Yeah.
One thing we tell our moms a lot is, you know, for some reason we think the second the baby comes out of the womb it has to have Thanksgiving dinner. No, it's fine. It can, you know, it has a day to learn how to breastfeed. So really, you know, a full-term healthy baby has at least a day to figure it out.
Yeah.
Because we expect a weight loss after
normal.
birth anyways.
Yes, thank you for mentioning
not,
that. Yes.
That's nothing to be
a
concerned
very
about.
A baby that doesn't lose weight after it's born, that's not wrong. That's not normal.
And then gradually over the next 1 or 2 weeks, kind of returning to birth weight is normal as well.
Yep.
So just
We like to see them get
10
back
to
to birth
14
weight by
days.
their 2 weeks.
Yeah.
Yep.
Yeah, because a lot of moms will know, I don't have any milk. I'm like, good. I don't want you to have mature milk yet. I want to have colostrum.
because the colostrum's thicker and it can be a bit more difficult for the baby to actually extract it.
Exactly. Yep.
Yeah, so any tips for those first hours, that first
Yes,
you know,
hand
initial-
expression.
Yes, so say.
Read my mind.
Express yourself, ladies.
Yeah. So after the baby is born, and it's something our nurses are doing in labor and delivery now really well to help initiate with the smell for the baby to find its way, and also any expression of milk in that first hour, via it be expression or pumping, so babies that have to go to the nursery that are ill and the mom is pumping right away. There's amazing data that shows that a mother that is expressing milk in that first crucial hour, she will overall produce milk like throughout her whole breastfeeding experience. So at 4 weeks out, she'll be making more. To 4 months out, she'll be making more. It's almost like
Especially
putting the order
first-time
in right away.
moms.
Right away.
Yeah, exactly.
Yeah, Stanford
So-
University does a lot of research on with Jane Morton, Dr. Jane, and it's phenomenal. And what would she say? 50% more milk on first-time moms.
Yeah.
Because they actually did a study, but that was with first-time moms, and she found that they actually produced almost 50% more in week 2, just with hand expression, the first few days of life, because that's really the most important. You make milk by early milk removal makes the best milk.
Puts the best order in for And sometimes when the babies aren't latching, the mother's really anxious. We have something called colostrum spoons where they look like, I don't know if I'm dating myself.
Oh, yes.
They look like little Baskin Robbins spoons. So the visual for the mom is really great to see that though, because it's realistic to fill a spoon of that size, and it makes sense visually that this is the amount for the baby versus a bottle that is obnoxiously
overwhelming, right?
Correct. That's not realistic. Right. Yeah. Exactly. So
Yeah. Oh, that's great. And then I heard somebody say it today in preparation for the show, thinking that, you know, is the baby going to suffocate? Really, like, babies' noses are built to breastfeed, right? Every baby has a little kind of pushed-in nose, flared nostrils, and so you know, don't worry about that.
Yes, this has unfortunately made some bad media recently with babies, you know. Suffocation. Well, you know, so you know, in the cases where actually one of the mothers, she was, you know, texting and not watching the baby or something. So you know, when you're doing skin to skin, you're obviously observing a baby. But yes, you're correct. The mother, you know, babies, they are really smart. And the interesting thing with that too is mom's body compensates for so much. So one of the things with babies with SIDS and things like that is overheating is not good, obviously. So you don't like a baby to be too hot. What was found, the woman who did a lot of the research on kangaroo care, I can't think of her name, it escapes me, I'm sorry, but she found that the mother's breast temperature never exceeds the temperature for a baby to be too hot. Right. You know, they found this out with twins. Yeah, so they had, an amazing study. They had twins, and one breast temperature was different than the other breast for each baby individually, but the breast temperature never rose higher than the, too high, temperature for the baby. I don't remember the exact measurement, but
And the mother's skin actually can act as a warming to prevent
correct
kind of brown fat from degrading and things like that. So
exactly.
It's just a good,
Well, what's funny, the temperature thing with skin to skin now. So skin to skin is not just throughout delivery. Right. So throughout the mother's entire hospital stay, and we even encourage it when she goes home, especially with dad,
and
to do skin to skin with dad. Yes.
If see, I wasn't making that up earlier.
No, skin to skin with dad is wonderful. There was a great study done in Australia where they found skin to skin or kangaroo care in the NICU with the baby's oxygen saturations responded just as well with dad doing kangaroo care as it did with mom.
Yes.
So that's just one thing. So dad is not a thermoregulator, but he still can do skin to skin, But the skin to skin is throughout the entire hospital stay and for when you go home. Yeah. We used to have a policy, the infant hypothermal, babies that were too cold. The policy back in the day used to be, okay, the baby's too cold, so anything less than 97.6, the baby had to go into the nursery and had to go into a radiant warmer. So the baby would, of course, get too hot and sweaty in the radiant warmer. The baby would come out hot and sweaty, and then the baby would be cold an hour later and then have to go into an isolette. Guess what the policy is now?
On to mom.
Skin to skin with mom for an hour, and then we have no more babies in the nursery under radiant warmers. It's wonderful. Yep.
And another thing I want to add too as well is when we're talking about with the baby, with the suffocation, with your breastfeeding, full-term babies, they have that suck, swallow, breathe coordination. You should always be watching your baby anyway while you're breastfeeding the baby. If the baby obviously is compromised, you definitely want to watch that a little bit more carefully. Right. And watching the color of the baby as well. But the babies do learn that coordination.
What are some signs that the baby might be in a little bit of distress in terms of?
Well, the baby wouldn't be sucking.
So you could hear the baby.
You wouldn't be, you would be hearing the baby because the nostrils will be flaring on the sides. Okay.
So we have a question from Yoon asking, what are the most effective tips for increasing a mother's milk supply?
It'd be interesting to know because it depends on how old the baby is and where she's at. And what so. And in reference to increasing milk supply period, it's always about supply and demand. So the more you stimulate, the more milk you make. So wherever she's at, I'm not sure where she's at, how new the old baby is. It depends, So
starting early, number one, like you said, like we just
starting early,
like just getting expression
those
early,
first latches.
beginning, and then after that.
After that, if she feels that her supply is low, she can always make sure the baby is maybe taking both sides of the breast or encourage pumping as well in addition to breastfeeding to try to get her supply up. It would really have to,
depends on
it depends
the
on
situation.
It's the more milk you remove, the more milk you make.
Right. It's like
and then is there a nutrition component in terms of like eating, drinking, in terms of the mom, in terms of staying hydrated? Is there anything? Is there not really?
They used to feel that way, but it's
well, because you got to look at third world countries. They're very malnourished, and those babies are not.
And they're not. So the mother's still producing.
Your body is focused on making milk for that baby. It's its primary focus.
Keeping the breast stimulated, keeping the
the production up, and a lot of times moms will feel like a dip in their supply if they go back to work. And I always tell moms, make sure you know what your magic number is. For example, if the babies are starting to sleep through the night, they're pumping during the work every 3 hours, and then they go home and they only stimulate, let's say if the baby ate 10 times that day, but she only removed milk 6 times, she's actually missing 4 opportunities to actually pump out milk. So then she goes to bed and she sleeps, and then she finds that her supply starts to kind of dip because she's not removing as much as the baby's taking. So it's a pump, it's not a baby. The baby's actually is the best pump you can ever get, and it's not going to do the same job as a pump. Obviously, the baby's going to do a much better job removing milk.
So Carrie had just a comment that she loves that you ladies are debunking a lot of myths. Colostrum is enough.
Carrie, we love you, Carrie.
Thanksgiving dinner, if day 1 is not needed. Breastfeeding can be hard and painful. Give it time and patience. And so glad that our moms in this area have you guys for a resource.
That's wonderful.
So let's talk about
the painful piece that she just mentioned was got my antennas up though.
Good.
So when I teach breastfeeding class, it's I usually say if you get anything out of what I say, because I know I tend to talk fast, is skin to skin, and breastfeeding should not be painful. Okay, you are going to feel a baby suckling at your breast, yes, but you should not have pain or trauma to your
No
nipples.
pinching.
Right, exactly. If you do, then that's something I would like you to talk to a lactation specialist about, because really, it usually 90% of the time it's a latch thing, and we can help them fix that.
Yes.
Yeah. I mean, there are a lot of women, and I hear this all the time. Well, you know, I breastfed for 2 years, but it really killed me in the first couple of weeks. And I said, well, you know what? I'm so proud that you did that, and you exceeded through that first couple of weeks of challenges. But it didn't have to necessarily be challenging the beginning like that. I'm glad you persevered through. You know what I mean? But it doesn't have to be that way. Breastfeeding really should not be painful. You're gonna feel it, but it shouldn't be painful.
And a lot of times moms will be like, oh, it hurts a little bit, but that's okay. But then the next day they're suffering because they're just so sore.
Yeah.
It takes one bad latch to really break
Do
it.
some damage.
Yeah.
So, what are some of the hardest things for kind of getting started for women? You know what I mean? Like you said, if it was so easy, you wouldn't have jobs. So, what do? You know what I mean? Like, literally, like, you know, how do you help them kind of get the process rolling? So, skin to skin. But then, what are some of the secrets to success? That's
Really
Positioning.
education.
Well, education, like, you know,
pre-education is
understanding
important.
the weight loss and the normal and all that stuff is one
And the
thing. So
cluster
once they get that, and
feeding,
cluster feeding as
knowing
well.
what to expect.
Right.
Yeah.
And so understanding that piece, the education of it, and then the physical hands-on piece is actually helping them. Some of these moms with their first babies, actually holding the baby in the right way to latch on. Yes, exactly.
Yeah.
You know, so you know, we do something called belly to belly, nose to nipple, tuck the bum.
Yes.
Is what we do.
Yes.
So when you position a baby on the breast, you want to position the baby so that its nose is lining up to the mom's nipple. So those of you can see me, right? This is mom's nipple. This is the baby's mouth. The baby should be down here with the nose lined up. So when the baby opens its mouth, it comes from below and it scoops on. It's not a bullseye.
It's not a bullseye.
Right. It's like biting into a big sandwich. You can't go straight. You got to tilt your head back a little like that. Okay. So now I get it. The baby has to do the same thing. So that tells you when the mother's trying to hold her baby, it's like, okay, does the baby go here, here? Oh, right there, nose to nipple. Okay. What about on the side of me? Same thing, nose to nipple. Now the belly to belly means the baby's belly has to face the mom's belly. If the baby's belly is facing the ceiling, then the baby has to turn its head to go to the mother. You don't want that.
Yeah, it won't be deep.
Right. Turn the baby's belly facing mom's belly so it's really, really close. Please, ladies, do not try to latch your newborn baby swaddled. There's too much junk in the way. Okay, the baby's chest and chin have to be really close to mom so that that chin can really get into the breast. And then the tucking the bum is just making sure they're not sagging down. Tuck that little bum in and keep them close.
Keep them supported.
If you do those three things, you pretty much got latched down.
And don't worry about the positions, because I was so freaked out with my first baby. Like, oh my God, I don't know the football hold. Oh no, I don't know this hold. I don't know how this hold. I don't know how to do. They're all the same. Your breast is a circle. Your baby can eat upside down. It's fine. It's a circle. So all those tips that Michelle was talking about, belly to belly, they're all the same. You can even lean back and just have your baby just latch on.
That's
like you do
actually
skin to skin. That first initial hour that you're actually doing that, your baby, if you just leave your baby alone, your baby will eventually find it. But just don't forget about all those positions. Just the basics are all the same with any position you do. As long as you have them, the baby will do fine.
And new moms getting used to, you know, and sometimes they're surprised at how close and tightly they have to hold the baby. You know, they're too relaxed and the baby is delicate to them, so they're, you know, and I, you know, encourage them. It's a big hug. Give your baby.
And they do sometimes feel like, I don't know, is it too close or?
And then you know,
it's just
I remember like some of them were like, I'm not sure if it's on, you know, and like, whoa, it's on. You know, baby's on. The baby is on. You know what I mean? Like, right? Like it's. You know what I mean? Like it's usually not subtle. You know, you're up and running. You know what I mean? And
right.
And it's such a great thing in medicine. Like the whole, like I mean, it's pretty far removed from it, but so much of medicine is sickness. But like the OB part of it is really awesome. Like,
it is awesome.
Delivery,
That's why we're in it.
It really is like such a great time to be part of. You know, and really nice to be part of people's lives during that time too. It's kind of such
fun.
It's like it's an intimate time, and it's such a shared thing. And I never ever got sick of watching the parent's face when the baby's born. It's just such an emotion that I can never really fully describe. We just fell in love with it. Never got sick of it ever. Just like when the mother, she has her baby latch on, she does it herself. And she's so proud. She's like, I did it. Like, yes. And I'm a very like passionate person about breast milk. So I high five people. I'm pretty much do jumping jacks. I'm like, yes, you did it.
This by you guys, which I love. Which is great.
Yeah, because I mean, you need cheerleaders. You need not just one. You need a whole high school team of cheerleaders, and that's what you need. Like we need to support everyone. We need to support women to make this work. Not just in the first few days.
And fathers to support moms, right?
And
actually, you know
some
what?
dads are awesome.
the most influential person in a woman's breastfeeding experience is the father of the baby.
Yes.
It's not her mother, her sister, her cousin, her girlfriend. It's the dad. That was a question on my boards. I don't know if it was for you, but anyway,
I don't remember.
It really is because, so sometimes, so dads out there, if anyone watching, if mom is really passionate about this and it's something she really wants to do,
support her.
Dad's really going to back her. Because on the second night after that baby's born, when that baby wants to basically eat constantly, which is normal, she's going to need the backing of you and be like, it's okay, this is normal, you're going to do a good job. Now, but it's not working, you can't do it. Because then it's going to,
And take care of everything else.
Right? The only thing that a dad...
Take care of everything else. Because that's her, priority number one.
Exactly. The only thing that dad can't do is feed. Everything else he can do, and there's a lot to do with a newborn baby.
Yes.
Would you like to
other ways to bond with the baby too.
Yeah. Seriously.
Yeah. But it's funny, we were just mentioning some of the positives, which are great, because we're talking about how some of things are challenging and difficult and stuff. Once you figure it out in the first week or two, it is so amazing after that. So easy. It's so much easier at 3 o'clock in the morning just to, roll over, pick up your baby, feed your baby, put your big down, you're all done. You don't have to go to the kitchen, you don't have to make it. It's so much easier after. It's great. Yeah. Anyway.
We used to joke around, like my friends, like when we were all having, our wives were having children and different things. It was funny, like most of them were breastfeeding. And like, remember, a lot of our wives were tired and going to see the baby. And I remember too, like, oh, can you just go help and go try? And I would be like, that's fine, Nicole, but I'm just telling you right now, he doesn't want me. You know what I mean? Like, I would walk into the nursery and it'd be like a little bit of a cry to like a fever pitch when both the boys, because they just didn't want me. You know what I mean? I just feel like,
you don't smell the same.
You're not what I want. You know what I mean? And I'd pick up and I'd bring back, you know what I mean? And it is really funny, but how easy it is though in terms of nursing and, you know what I mean? And just, it was versus like, having to heat up formula, go downstairs, and just in terms of quality of life,
It's funny, so a little bit more on the hospital say too, not to the moms and the dads that may be listening, but to family and friends of people who are having babies, the best thing you can do to support your family or friend who's having a baby is to leave them alone. Visiting is so difficult because this mom and this dad are exhausted. They've been there, mom labored for a while and now she's tired, and then what happens is throughout the entire day in the hospital, mom is interrupted with hospital staff. So it's us, it's the nurse, it's the doctor, it's the other doctor, it's the cleaning lady, it's the lunch lady, it's the picture lady, it's the birth certificate lady. It's constantly somebody coming in, and I understand like our families, they love the baby, they mean well, and they want to be supportive. But in other parts of the world where breastfeeding is extremely successful, they are left, like most of the moms are left alone after the baby's born to really help establish and get that going. Our culture around here is the complete opposite. It's considered to be rude when you don't go visit the baby. So I just wanted to let people know you're actually doing. You're doing, it's not...
Let them rest.
Yes, exactly.
Yeah, and also, like, there are other ways that they can help. Like, for example, if they are able to do either dinner and just...
Crock-pot meal.
Yeah, crock-pot meal and bring it. Also, they can actually even do frozen meals before they actually have the baby, so that way they're not always ordering pizza all the time, and it's a nice, home-cooked meal. Things like that to actually have them have more time with the baby and a little bit more time. 5 minutes of sleep feels like 5 hours. It really does when you have a brand new baby.
So we have some great comments. One from Kristen saying that she loves how much she continues to learn from you both. So amazing.
Hi, Kristen.
So graceful.
Kristen is one of our CLCs.
Okay.
Kristen's our sunshine.
Yes, she does the Thursday Cafe.
She's our sunshine girl.
Yes.
And there's actually a question from Kim asking if you can talk about how you know that the baby is getting fed enough. They get questions from moms and families about that all the time. So not just in that newborn period, but maybe a little bit afterwards.
So we mentioned earlier we like the babies to get back to birth weight by 2 weeks. So a lot of the family members like to see measurements. So people, when they don't have a bottle full and a bottle empty, they wonder how much is the baby getting. So the measurements we have with a newborn is how many times it pees and it poops, and the weight frequency. So how much weight it is losing and how many times it pees and it poops. So in a baby's firstborn, we expect 1 pee, 1 poop for its first day of life, 2 pees, 2 poops for the second day, 3 and 3 for the third day, and so on until they're about 4 or 5 days old, and it can fluctuate. So as long as we have that much output, we know that there's that much input. And babies usually lose about 7 to 10% of their birth weight. And sometimes parents get a little confused with that, but not every baby can lose the same amount of ounces. I mean, an 8-pound baby can lose more than a 5-pound baby. So we talk in percentages. So a baby will lose 7 to 10% of its birth weight. That's normal. So the baby's obviously fine. Get back to birth weight by 2 weeks. That's wonderful. And as long as they continue to pee and poop just fine, we expect them to double their weight by 6 months and triple it by a year. And Moms, once they leave the hospital and their milk transition happens, they go from colostrum to mature milk. It's very reassuring for them because they feel it then in their breast.
Yeah, and they can hear
they can hear the baby swallowing
yeah.
more. They can feel their breast full, and then when the baby nurses, oh, it's softer now. Oh, I guess the baby got
so
something.
the confidence builds up.
Right.
And also like the frequency in a 24-hour period. You
Yes.
want to make sure that you have 8 or more feedings in a 24-hour period. And when we talk about 8 or more feedings, we're not talking about 8 feedings of like 2-minute feedings. They need to be a good quality feeding, meaning that the baby is pulling at the breast. You can feel the pulling for, not 2 minutes, but at least a good 10, 15 minutes, as long as the baby wants. But we're talking about, at least like 10, 15 minutes or more.
And I think you also have to be careful about letting it go on too long, because I think some women worry about, in a sign that maybe things actually might not be working well if it's taking too long to feed. For the baby to get so that might be a latch issue in terms of, so
Yeah.
it varies, I guess, depending on the age size of the infant, but how long they're typically on the breast nursing.
Yeah.
Yeah, there's no exact number of every baby should feed for 15 minutes.
Yeah.
There really isn't.
Yeah.
Every baby's different. Some babies are better at transferring milk than others, so they'll have shorter feeds, whereas other
As they
babies
get
don't
older,
transfer milk.
right. Yeah,
Yes,
not the brand new.
And luckily, the visits to the pediatrician are so frequent.
Stay on top of that.
So,
Exactly.
So if
Right.
it's gone a week or so, and maybe things aren't going quite right, it's not going to
It's not
going
going
to
to
go
that
on
far.
for too long.
Exactly.
Yeah.
The babies are weighed every day in the hospital, and then every baby who's being breastfed is seen their pediatrician within 1 to 2 days after discharge.
Yeah.
So they're,
Yes.
we want to make sure that, because we expect the weight to continue to drop until the milk transition happens, and that's going to happen in a day or two after they leave the hospital with a vaginal delivery. Some of our C-sections, if they stay for the 4 days, we'll even see milk transition happen in the hospital, and we see it go the other way.
And usually the babies who are born C-section actually have usually a higher weight loss due to the IV fluids usually. That's a very normal thing.
Oh, we got a live one. Kristen says she says, how cool is this the support in this area. She's nursing her 6-week-old as she watches this, and she also nursed her first for 2 years. So
Great job, Kristen. That's good.
glad
Good
you're
job.
tuning in.
Oh.
So that's great.
Yep.
So in terms of other kind of troubleshooting issues with breastfeeding, if you've had a good, first few weeks and things are going well, what are some common kind of problems a little bit later that people encounter?
I'd say growth spurts is a big
Growth
thing
spurts,
because
okay.
a lot of women will quit at 4 weeks, and that's actually that's when the growth spurts start to happen. Usually it's usually at 2 weeks, and then usually every 4 to 6 weeks. So a lot of women will say, I did it for a month, and because I didn't have any milk, I ran out of milk, I dried up. But that's actually a really important growth spurt time. So that's a big thing and a big reason why women quit, because they don't think they have enough milk. But if your babies are gaining and they're voiding and stooling and they're eating at least 8 times a day, they're doing fine. They're absolutely doing fine.
Yeah, the perception happens because in the growth spurt, they feed more often, and the mother's perception is, I mustn't have enough now. So, call us.
What happens about, in terms of, what about like kind of infections, or sometimes, God forbid, the woman's breast can get inflamed, mastitis, which may or may not be infectious or not, engorged, in terms of helping women get through that. What kind of services? So first of all, women can come back to you guys. That's a really important thing to know, that because you kind of leave and you're okay and you're exhausted, but then things can happen at home.
Yes, exactly.
Right?
Call us so you can come back. Exactly.
And not just in the first month, but it could be
we
anytime,
have moms calling us. I mean, over a year, I had a weaning call. I had another. They call.
And when they leave the hospital, we make sure that they have our phone number. We actually give them a paper that has baby cafe information, and also as well as our phone numbers, and they will definitely usually contact us, or they'll come to baby cafe and ask us some questions.
We have many baby cafe graduates. Most of the people go to cafe, they stay for a while. But issues like you discussed, so something like mastitis, for example. So mastitis is typically an infection in the breast. That's something that actually, before I even say that, almost any issue or difficulty that arises with breastfeeding is fixed with breastfeeding. Just to make that simple, okay? If you have a low milk supply, breastfeed more. You're going to increase your milk supply. If you have too much milk, breastfeed the baby. The baby will, put the order in for the amount of milk you need. Okay, don't pump.
Just make more milk.
Just make more milk. Exactly. If you have mastitis, the last thing you want to do is stop breastfeeding. You need to continue to breastfeed. The infection will be worse if you stop.
Empty out your breast.
Right, and so a lot of the times, so mastitis, if that happens, which happens to some people, typically mothers who are overly pumping or produce a lot of milk, you can't miss it. You have flu-like symptoms. Your breast will be painful. Sometimes it can be red, but it's very quick onset. well, you felt fine this morning, and by noontime, afternoon, you feel like you have the flu. You would have to call your obstetrician, and they would get you on antibiotics, but you definitely can still breastfeed. It's actually encouraged. And
sometimes it starts with a plug duct, so you would be actually be able to, so knowing the early signs, so if you start feeling like an area that's not fully emptying, you really want to make sure you try to get that out. So if the baby's feeding, you want to massage kind of behind it towards the baby, get rid of it. If your baby comes off and you're still feeling that area that's hardened, then you want hand express. That's what you want to do, and that really works tremendous. Some people sit with the pump, and the pump does not do a good job at all with plug ducts. You just really use your hands, and that really is
Warm
much better
compresses
job.
or hot showers, is that still
Yes, definitely.
pretty far removed
No,
from,
no,
I just want to make sure I'm
And
staying.
definitely we can massage before the hand expression works definitely much better.
Yeah, the warm compress is always encouraged when you have, full.
Yes.
I mean, it's normal when you leave the hospital on the day 3-5 after you leave the hospital is when milk transition happens, and that's when mothers typically get that fullness. So it's important to just breastfeed, so you put the order in for the right amount of milk for your baby. A lot of mothers will pump at that time because it feels great. They pump and it kind of softens their breast a little bit. They're like, oh, I'm good. Well, guess what? Now you just put an order in for more milk. So now what was going to last 2 days is going to last 3-4 days longer because you're asking your body to make even more.
So that'll just back
You'll
things up
right.
even more.
Exactly. Mother Nature kind of knew what it was doing. Let your body balance out.
Evolution's funny like that.
Exactly, right. Yep.
So Ashley said, love this, love the CLCs, and she wouldn't be crossing the 1-year mark breastfeeding if it wasn't for you and Baby Cafe.
Oh,
So
that's great. Thank you.
Great feedback.
Yeah.
Any other common issues with breastfeeding kind of longer down the line? Engorgement we talked about. Kind of, what about nipple sensitivity and it's just a problem with latching?
Yeah,
or
nipple
anything
sensitivity
like
would be earlier on.
Okay.
The only other problems I would say going into the future is when mothers go back to work.
Yeah, work is a big,
That's-
it's hard,
yeah.
because moms, like, when they come to work, they're already think about, okay, Terry, I'm gonna go back to work, what am I gonna, let's just take one day at a time.
Oh, I know.
Let's take one day at a time, because they're so stressed about going back to work, and it is a big stressor. It's a stressor for them. Where am I going to pump? How am I going to do this? Teachers, for some reason, teachers and bartenders.
Teachers are the,
They have the hardest time pumping. I've had moms pump in the car, whatever works. But teachers, for some reason, have the hardest time to pump. They just don't have the time in between classes. But there are ways. Sometimes I've been hearing more and more in the schools that they're having closets of breast pumping, which is kind of cool. And they make signs on the outside of the door. So it's getting out there more and more. But some of the older
I think it's
buildings,
required by your employer.
It is
to have
correct, yeah.
So
Years ago.
It's federal law,
Yeah.
yeah. If you have more than 50 employees, they should provide a space. Yes.
Exactly. Yep.
My wife went back to work. She had this great woman, like, boss. It was awesome. It was really great. And my wife went back, same thing, nervous. She had to pump. She wasn't sure, you know what I mean? And she was going to say, like, I think she was, like, pumping necessarily into the bathroom, the pump. And her boss kind of walked in. My wife was, like, shy. And she was like, oh, no, you don't eat in the bathroom. You're not pumping in the bathroom.
Oh, she's the
it.
best.
You know what I mean? Like, it was like, no, it was like, no, we don't eat in the
I
bathroom.
love it.
You're not pumping in the bathroom.
That's
Like,
awesome.
there will be, like, you will use my office, you know what I mean? Like, there will be a room, and it's just
Hear that, all you bosses out there?
It's so true, right? Like, no,
Love
like,
it.
no.
Love it.
Like, we don't eat in
Exactly.
closets.
And they feel
We-
special too, that they're important enough to make sure that what's important to you, it's important to them as
She'll have
well.
better success pumping too,
Yeah.
because she won't be as stressed and rushed. She'll be able to relax, and the other thing that happens
And she
too-
won't miss work because her kids won't be as sick as often as well.
This is true. When moms go back to work, and whoever is caring for the baby when the mom goes back to work, one good thing for them to learn, whether it be a daycare provider or a family member, is to learn how to pace bottle feed a baby. Okay, so when the baby is taking breast milk in a bottle, which is wonderful, it's something you want your baby to learn how to do if you have to go back to work. But if you moms out there, you want to Google something called paced bottle feeding. I'm not it really
Tastes like paced
No, I'm
back
laughing
and
about
forth.
this. I don't mean to, I could talk in this whole show about my own personal anecdotes about but I'm laughing about this story too.
So
I mean,
the number one YouTube video that comes up if you Google paced bottle feeding is actually used by many hospitals.
Yeah.
There's an IBCLC like ourselves,
Yeah.
and she's holding a doll. She's blonde colored. She has blonde colored hair, blonde hair.
Jessica Barton,
And she
maybe.
teaches you how to pace bottle feed, because what happens is the mothers go back to work and then the baby's taking the milk from the bottle. Most babies will take more milk from that bottle than they do with the mom because they chug a lug.
Yeah.
And they take it too quickly and too fast.
Yeah.
Whereas if you feed them paced bottle feeding, meaning instead of holding the bottle upright and letting them chug, 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 you hold the bottle down straighter. And I don't care if they get air, they'll burp, no big deal. Yeah. But you pace their feeding. You slow them down. You stop every once in a while and you pace them. Because all the time the mothers, they come in, oh, I gave the so-and-so this many ounces and they said it wasn't enough. And I know that the baby doesn't need that much. You know, so
you hear that all the time. And they go through their breast milk so fast. And,
So whoever's going to be taking care of the baby and feeding the baby, have them learn how to feed the baby slower with a bottle. That would be helpful.
Yeah.
And if they go to, like, if you have to put your child in a daycare, I definitely recommend walking through and seeing how they feel about breast milk and storing breast milk and get a good perception of how they treat that, because that's very important.
Do you have recommendations on breast pumps? Is that something you feel comfortable recommending or not? I don't know.
We don't really have any affiliations with any pumps yet, but Southcoast does use a specific brand that we do have a contract with. But if the mothers have any questions about pumps, they can always call our milk line and reach out. I mean, a double electric pump, if you're going to be going back to work, is recommended for sure.
Yeah, a good quality. Make sure you do your research on it.
Do your research.
As well,
pumping is something. I hate to say this, but. It's one of those things you get what you pay for type things. Did I ever say that? You know, you want to be careful. You don't just want to buy the one over the counter. Oh, but as far as pumps go, actually, we can say this.
Yeah, which ones we give out, you mean?
Don't buy any. Because pretty much every insurance covers a breast pump.
Yes. So you don't have to worry about that.
Yeah, there are very few very few insurances that don't cover pumps anymore. So a lot of our women, and actually this is something that we recently just changed at St. Luke's, because some of the women were getting pumps before they would have their babies. You're better off not doing that.
We don't do that.
Because if you come in and we help to get your pump for you, we'll take care of it. We'll take care of it with the insurance. We'll do the audit. We'll do everything.
And there's no copay or anything.
We'll make sure that we get the pump that matches you best.
Ooh, that's great to hear.
And the other thing, some insurances, if you have a premature baby, for instance, you have no idea that that's going to happen, correct? Some insurances will cover a better pump if you have a preemie. But if you've already gotten a pump ahead of time because you're very proactive and these moms are out there and they want to get all their stuff ready in advance, now they don't have the option to get that better pump because they've already gotten it. So anybody who's pregnant out there, anybody who is, don't get your pump ahead of time. We'll take care of it for you.
And there's some different options too, and knowing all those options is important as well, because you can upgrade for different types of pumps. And some companies, because we work with a supply company, and some supply companies will charge differently at different ones. And I've had people pay double the amount of what other people pay, so it's important to know. Don't just work with one supply company, call others and see what the price differences are.
What about maternal, like coffee, smoking, alcohol while breastfeeding?
So we discouraged smoking, period, obviously.
Yes.
Better wait.
Yes.
Okay.
Not healthy.
Without a doubt.
Page.
And I was seeing that came up when it comes to marijuana, even though it may be legal around here. Marijuana is contraindicated with breastfeeding. You will be told by your provider that you cannot be breastfeeding while if you're
there's no studies on it.
So there's a lot of new research that's going into this, trying to get more data, because the best data we have on marijuana and breastfeeding is back from the 80s, which is not the marijuana of today.
And it was inconsistent.
Right.
So no smoking, no marijuana.
No smoking, no marijuana. Exactly. Yeah. But can you have that glass of wine? Oh, sure you can.
Yeah, people in Europe would not breastfeed. I always tell them, people in Europe would never breastfeed if they could.
There are all sorts of stories about the timing, 10 minutes before, 1 minute after. So what's the story with that?
Can you have a glass of wine? Yes. Can you have it every day, every meal? No. But if you do have a glass of wine, it's perfectly fine to
breastfeeding or not, you can't do that.
There you go, right?
No eye
Right. There is a general recommendation of 2 hours after.
2 hours per drink,
So after you breastfeed.
Well,
no.
After per drink.
Okay. So drink your glass of wine and then breastfeed 2 hours after.
Yeah. So when I talk about glass of wine, it's not the bottle of wine, it's the glass. That's when we're talking about that. Yeah. So like 1 beer, 1 glass of wine, and a 2-ounce shot. Right. I think what it was. So it's like 2 hours per drink. Yeah. At any time though, if you, because it depends on how you. Obviously, if I have that, I would not. I'd probably be, if you're feeling under the weather, not under the weather, but if you're feeling a little loopy, still even after the 2 hours, I still will not recommend. Recommend breastfeeding.
We all metabolize differently.
Yeah, if you're alert oriented and absolutely it's fine.
Okay. What about caffeine?
Caffeine is fine too, but everything in moderation.
Depends on the baby.
Some babies respond to caffeine different than others. When we get a mom that tells me my baby's never sleep, and we find out, you're still a living on Dunkin' kind of person, then that maybe want to cut back. So it's fine. The other thing that we get questions about a lot is certain medications and things like that. There are very few medications that you cannot take while breastfeeding.
Yeah.
Okay. Most physicians and pharmacists will err on the side of caution, and they'll say notify a lactation consultant, or that, if they're unsure. Seek us out, please. Don't ever throw breast milk away that you're questioning because you may have taken this or did that.
Yes, because Terry and Michelle will go to your house and take it out of the garbage. Yes. Do not do that.
Every drop. Right, exactly.
And they have, we can talk about, there's actually, it's like apps that you actually can download too as well. There's one that's LactMed, LACTMED, and it's free. You can download that. We use that as well. Physicians also use that. But also check with your physician as well, your pediatrician, and double check. Sometimes I'll hear stories like, oh, they told me to pump and dump for 24 hours after having surgery. Most cases, that's not true. That's not necessary, I should say. Definitely give us a call, and we can send you in the right direction, and definitely call your pediatrician. They are the ones who are familiar with your baby. That's what they specialize in.
So that's good. Can we talk really quickly about weaning?
Weaning,
yes. Or do we need another show for that?
I know, that's funny because
it depends on the situation.
So weaning is
when mother and baby are ready to do so. Okay, so the recommendation for breastfeeding, American Academy of Pediatrics recommendations, so is to exclusively breastfeed for 6 months. So your baby receives nothing but breast milk for the first 6 months of its life. And then at 6 months, it's recommended to introduce solids, and solids, talk to your pediatrician at that point.
What to start with, yes.
Right. Yes. And then from 6 months to a year, you would continue to, breastfeed and give food. Beyond a year is completely up to you. Whatever you and your baby choose to do. If you stop breastfeeding before a year, you'd have to supplement with some kind of a formula supplementation. If you make it to the year and you're on, then your baby's all set. And they're eating, exactly. That's the American Academy recommendations. There are other parts of the world where it's recommended 2 years.
The World Health Organization and UNICEF. The two among that they will recommend.
So it's really
it just depends on you.
Every mom.
And as the baby takes less, the mom produces less milk.
Yes.
And hopefully should be a pretty smooth transition.
Right, exactly.
The nighttime one might be a little more difficult because that's also a bonding for the baby as well. That's a tough one to get rid of, is the last one. Yeah.
That's great. We're all caught up in the queue here.
The only thing we didn't talk about was baby friendly.
Oh yeah, that's huge.
Right.
Yes.
What do we miss?
We have to do.
Yes, baby friendly is a very big thing.
So baby friendly. What
is that? Okay. So Baby Friendly is an international accreditation that hospitals can obtain. Basically states that if you deliver a baby at this specific hospital, they do everything in the right way and form. There are 10 steps that we follow for you to have the best breastfeeding start for you and your baby. So in the United States, it's Baby Friendly USA. So Toby has already achieved this accreditation. They achieved it back in 2011, and then they recertified a few years ago. And Charlton and St. Luke's are now on the pathway. St. Luke's is up for our survey in September.
Yes. And Charlton will be in the fall or maybe early winter. So we'll be on the right.
As long as we're following our 10 commandments of baby friendly, I call them, we'll pass, and we'll be one of the first system-wide hospital systems in the state to be baby friendly.
Across all the hospitals.
As far as I knew, last I knew, Massachusetts did not have any other system-wide.
We'll be the first hospital. We'll be the first system-wide. Which is pretty amazing.
If we beat the
deadline.
And
it's changed our practice quite a bit. It really has. Because of the baby friendly, we actually started doing skin to skin. And I remember, nurses are creatures of habit. And I remember when we first started doing skin, I'm like, oh, is this really necessary? Blah, blah, blah. But now I watch the baby's transition. It's amazing to watch and how I look back and how we really didn't support our babies really well with that because we interrupted what was really important to make that bond with the baby. And because of Baby Friendly and their 10 commandments, really has helped us turn around quite a bit and support mom and baby together.
Because step 4 of the 10 commandments is that skin to skin happens.
If that happens.
Yes, 80% of your patients have to have reported it.
Because skin to skin initiates also.
The first hour of breastfeeding.
Yep, that's right.
Exactly.
It promotes breastfeeding.
Mother Nature, like you said, knew what they were doing. So one last question, actually, coming in from Kristen. Any insight on high lipase enzymes in milk? With her first daughter, her frozen milk after defrosted had terrible smell and taste, and she wouldn't take it, and she believes that is why. Not sure if that's the case, and no more frozen milk that she used. So why does it happen?
Lipase tends to have, when you freeze milk that has a high lipase
someone might have
constitution,
that, yeah.
it will, and then you thaw it, when it goes through that process, it tends to have a soapy, soury smell.
Yeah.
The milk is absolutely fine, there's nothing wrong with it, but some babies do have a tough time with it. She doesn't want to discard the milk if she can mix some fresh milk with it to maybe dilute it a little bit and make that, you know what I mean?
Good idea.
Yeah, but sometimes, some babies just will give you a tough time with that.
And there's also a way of like heating it as well. I can't remember the specifics with that,
yeah,
but there is a way that you can
it's
actually heat it to
it's a
decrease the
complicated process,
lipase,
Yeah.
and that can help too. So yeah, try not to throw it out. Try to use
Don't
that
ever
and
throw
see if
milk
that
away.
helps out. Yeah. But there is kind of almost like a soapy taste. Yeah.
That's great. So we're all caught up here in the queue.
Great questions, Kristen. By the way.
Yeah. Any parting thoughts from you or any?
No, I think, did you guys, do we miss anything? Is there anything
No, I
else?
think,
Wow, I feel like did we?
Can you believe it was an hour?
I
The
think,
recommendations. Yeah, I don't know. I think we
And
covered
stay tuned for the baby friendly certifications.
yes,
from-
baby friendly certifications coming up, so Southcoast.
Yes, we're very excited.
Congratulations on all your
Very
hard work.
excited.
Happy World Breastfeeding Week, everybody.
Yes.
Terri, Michelle, thank you so much for coming on.
Thank you for having us
Your
here.
enthusiasm
Yeah,
is
it's great.
contagious.
Thank you for everything you
It
do
really
for
is.
us.
It just actually is so funny. It just brings me back to just a great time.
Yeah.
The women in this area are really lucky to have these services that you guys have created and built, along with a team of other people who help kind of us do what we do every day. So it's really great. For people who are watching the show tonight, please, please, please share it, post it, give it to anyone that kind of, any new mothers or women who are about expecting children, because it's really, really important information.
Yep.
Because the benefits for both mom and baby are fantastic.
Oh, actually, can I do my if I forgot one thing, actually.
Absolutely.
I want to let you know with the baby-friendly recommendations, that also that our nurses, a lot of people get really nervous when they come in, and I want to only see a lactation consultant. Our nurses are really getting awesome at positioning. I go in there and I'm like, wow, don't need to do a thing. They're amazing. They actually have to take educations required to do 20 hours, and 5 of those hours are supervised lactation. So just to let you know that they're perfectly capable and they're excellent with supporting moms with breastfeeding.
Good. Great.
Wonderful. Thank you so much for everything you do for all of our patients in the community, and we'll have to have you back for round 2.
We'd love to be back and talk about breast milk all the time.
Thank you to everyone who tuned in tonight for a really great interactive show. I love it. We hope everyone's having a great summer. It's hard to believe it's August 1st. Stay healthy, Southcoast. We'll see you next week.
By the time I graduated high school, I think I was between 275 and 300. I had to buy my dress clothes at the Big and Tall store. Enough is enough. Southcoast Health gave me the tools, and here I am, with my health. And I was a 46 going into a 48, and now I'm a 30-inch waist. I'm living proof to show if you put the work in on anything that you can get what you want. Take impossible, throw it out of your vocabulary.